you for joining me today. I'm Dr. Mahendra Carpen, Head of Medical Services and Cardiology at the Georgetown Public Hospital Corporation. This is the program, Your Doctor and COVID. And if you have any questions, you may WhatsApp to 620-6275 or send an email to docandcovid@gmail.com. As usual, I'm going to start off by showing you how to wear your mask, which is to completely cover the nose and the mouth, and not just covering one of those areas, not under the nose and definitely not under the chin. I'm going to take this off as we continue our conversation so that we can understand each other better. So today, it's important that we start off talking about masks because the topic and the conversation revolves around masks. There are several types of masks that we can see people wearing in the society, and in fact, just recently I returned from an overseas trip in a very nice place, and doctors there were actually, a couple of them were wearing what we consider brand name masks. People were wearing Louis Vuitton masks and Guess masks, but for our purposes, a mask is supposed to be protective, and if you can make it fashionable, then why not? We have several types of masks in use. The usual cloth mask. There is the surgical mask that the surgeons or doctors and healthcare workers wear on a regular basis. Then there are the N95 and KN95 masks, which are higher grade medical masks that are designed to filter out much smaller particles from the air and protect the wearer from the actual atmospheric air. At the same time, the mask is designed in such a way that it will protect the environment or those around the wearer from any air that is expelled or breathed out by the wearer. So you may have seen signs in many establishments that are requiring wearing masks before any service is offered. And you may see this in public spaces, public buildings, in supermarkets, in pharmacies, in hospitals. Many places have adopted this policy of wearing masks before any service is rendered, and also washing hands and sanitizing of the shoes. On average, around the world, the WHO estimates that on a monthly basis, we use 89 million masks for healthcare workers as they go about their job. We use another 30 million gowns with 1.6 million goggles, 76 million gloves, and 2.9 million liters of hand sanitizer. That's a huge consumption of equipment and products to make us safe or keep us safe from potential COVID-19 infection. And it's not just COVID-19, but there are other pathogens and other potential infections in the air and on surfaces that we can also be exposed to and become at risk for. But why do we really wear a face covering? A face covering essentially stops your germs from reaching others, and if you touch the covering, wash your hands. It also protects you from becoming exposed to germs in the air and germs from others who are around you who may sneeze or cough close by. Masks do not replace hand washing. Wash your hands with soap and water regularly. For reusable coverings, remove them and wash if you can at 60 degrees. Clean your hands with soap and water. And for masks and other personal protective equipment designed for single use, dispose of them in a closed bin and immediately wash your hands with soap and water. Masks actually helps everyone around you, yourself and those with whom you are in close contact with. Cloth, face coverings or masks that are made with cloth can help slow the spread, including from people who may not know that they are infected. So these are the asymptomatic people, and these are actually significant percentage of COVID-19 spreaders and carriers. Because remember, as we would have spoken about in our earlier conversations, many persons, at least within the first 7 days or so, may not know that they have the infection, and because they have no symptoms, there's no reason for them to actually be concerned. And that's one of the things that makes COVID-19 so dangerous, because asymptomatic persons can spread it and cause significant infection among the population. This is quite different from other significant infections like SARS and Ebola, etc. In those patients, very early on in the infection, they would have developed symptoms, so it made it very easy to isolate those patients and start treatment and to track their contacts. Who are the people who are really at risks, and how do we risk stratify these persons? So let us look at two groups of persons, the carrier and the person or others. So that's someone who's carrying and someone who is normal. If both of those persons have no mask, that is the highest risk group. That transmission can occur much easier from the carrier into the recipient who does not have the infection. If the normal person has on a mask, but the carrier has no mask, then that would be the next level of risk. The low risk group is if the carrier has the mask on, but the non-carrier or the healthy person does not have the mask on. And the lowest risk is when everybody wears a mask. So it's very important for us to emphasize how critical it is for everyone to wear their mask. It's uncomfortable, but it's definitely not as uncomfortable as an ICU bed or being intubated and being on a ventilator that breathes for you. It's very important to understand how quickly these germs can spread. And they can spread by just normal breathing, by a cough or a sneeze. A single normal breath in an infected person can release 50 to 5,000 droplets. Most of these droplets are low velocity, that means they're not moving very quickly, and they can fall to the ground very quickly. There are even fewer droplets released through nose breathing. Some people breathe through their nose, some breathe through their mouth. Let's look at coughing. The cough, a single cough can release about 3,000 droplets, which can travel up to 50 miles per hour. That's a lot of speed. Most droplets are large and can fall quickly, but many stay in the air and can travel across a room in a few seconds. And the most dangerous of the lot is a sneeze, which a single sneeze can release up to 30,000 droplets. And these droplets can travel at a speed of up to 200 miles per hour. Most droplets are small and can easily travel across the room. That's when we have a sneeze occurring in an infected person. So why does the mask wearing matter? Because COVID-19 can be spread by people who feel healthy, and it is transmitted by droplets emitted when people speak, cough, or sneeze. Your mask, if you wear it, protect others, and their masks protect you. There are essential places like groceries, pharmacies, public transportation, etc., like our minibuses, where maintaining social distance, although it's necessary, it can become very challenging. And wearing masks is something that we may all have to become accustomed to as we safely reopen our country and our services. So this is something that we have to get our minds conditioned to doing. Wearing your mask and of course washing your hands and maintaining social distancing as much as possible. Does this work? Well, yes. Let's look at countries that actually have mandatory or enforced mask wearing versus those that don't. And if we look at the number of cases per million population in several very developed countries and look at them, those who are not wearing masks versus those who are wearing masks. And we can see the number of cases in countries like Taiwan, Thailand, Hong Kong, and Japan, where wearing masks is mandatory and enforced. The number of cases are much less per million than in countries that did not have a mandatory mask wearing policy, like Spain, Italy, United Kingdom, and Germany, etc. And we're familiar with this because we can see that on TV and we watch the news all the time, and we can see cases rising all over the world. When do we actually need to wear masks more importantly? The key times to wear a mask, especially is when you're out in public. When you yourself are sick and interacting with others at home, or when you are caring for someone who is sick at home. Generally, we do not recommend masks for children under the age of 2 because they're not going to keep it on anyway, or it might become something that makes it difficult for them to actually breathe. Anyone who has trouble breathing, that's not a good patient to have mask wearing recommended. And anyone who cannot take off the mask without needing help. When you're choosing the mask, choose masks that have 2 or more layers that actually have a double chance of protection. Cover mouth and nose completely, and make sure as much as possible that the mask fits snugly against the side of your face. I remember in the SARS epidemic that we had, there were times when we had to be fitted for the N95 mask. That is they come in different sizes and shapes, and each person's face is different, so it has to be custom fitted for each person. Unfortunately, I don't think we have enough in the supplies around the world to enforce that kind of standard, but it is still important to make it fit as snugly as possible to the sides of your face. And what about the types of masks and the types of protection that they offer? Well, masks reduce the risk of spread. There's no doubt about it, but they do not eliminate the spread. The cloth masks are about 10 to 40%, and if you double up those layers, the effectiveness becomes better. Double layer fitted cloth masks are almost as effective as the medically graded surgical mask. The N95 masks are the best because they are more than 95% effective at reducing the transmission of small particles. And the only way to avoid complete exposure or any exposure at all is by having full hazmat suits and living in a bubble, which is not very practical. So I hope this would have shed some light on some of the important features and some of the reasons why we continue to advocate that people wear masks during this COVID-19 pandemic. Remember, if you have questions, you can WhatsApp 620-6275 or send emails to docandcovid@gmail.com. Thank you for joining us.